And we're in a series on diabetes right now. And last week we talked about toxin-induced diabetes. So today we're going to talk about neurologically induced diabetes. And because it's such a progressive condition, let's take an alternative approach and try something different. The likelihood that you've been checked for what I'm going to show you today, and when I say the word show, I don't just mean on our show. I mean physically, you got to see this. So if you haven't figured it out, not only are we on the airways, 94.7 FM, but we're also streaming this right now. And the streams are on YouTube and Facebook. And so if you have any opportunity at this second to hop onto a computer, a tablet, a phone, a PC, whatever, go to youtube.com, facebook.com. Your handle is Ask Dr. Ernst, AskDrErnst. And you can see the live stream. We're also going to be giving away a ton of stuff today, just like we did last week. The ebook for reversing diabetes is free. The webinar is coming up in about 2 weeks. It's free. And we just need to know if you guys want to join us. So head on over to the Facebook feeds, hit the YouTube feeds, and while you're there, take a moment and subscribe, okay? Like, we have thousands of hours worth of information in multitudes of conditions. Though this show is new to Fox Sports Charlotte, we've been on air for over 15 years. We've been in Charlotte over 15 years, and we've been helping people like you take control of your health using functionally integrative, holistic, and natural techniques. No medications required, just pure healing. And today we're talking about the nerve connection to diabetes. Hey, if you want some more information about us, who we are, what we do, how we serve the Carolina and the greater U.S., head on over to AskDrErnst.com. That's AskDrErnst.com. You can see all about us, our locations around the Carolinas, and also you can search for anything you want. So if you go to the .com and you hit the little magnifying glass and you have whatever, type it in, hit return, and you're going to find article after article, protocol after protocol. Guys, we give it all away for free because, again, you're supposed to heal yourself. The one thing I've learned being a physician now functionally for the last 15 years, everybody knows that they want to heal by themselves. I mean, I've never met someone who says, Doc, the last thing I want to do is let this heal by itself. No, we have this understanding that the human body has an innate level of healing inside of it, but most of us don't know how to engage it. We don't know how to leverage it. Like, you have a ton of power. So I want you to use an analogy for me for a minute. Think of a dam, okay? It's like the Hoover Dam, as far as I know it, is like the largest man-made dam in the world. It has more concrete than any other dam, according to this article that I read. And what's unique about it is because it's so big, it blocks off the Colorado River, I believe, and it creates a lake that's man-made, and all that water piles up behind this dam, and there's a lot of power inside of that. And if I was to ask you, I want you to convert that stored energy in the water into electricity, you would probably say, oh, so the potential for gravity, and if we open up a small portion of the dam, and if we install a wheel, it'll generate electricity. We know how it works, but I want you to go do that. In your hometown, I want you to build a dam, I want you to block off some river, and I want you to generate electricity. See, now when the rubber hits the road, I know it's supposed to work, but I don't really know how to do that. I'm a school teacher, I'm a burger flipper, I'm a cashier, I'm a whatever. I invest money. You see where I'm going with this? We understand it conceptually. The human body's supposed to heal itself. Yeah, I agree with that. Now go heal yourself. How do I do that? So that's what we do, guys. We teach you the steps that you need to heal your condition. And the neat thing about it is it works for everything. It works for autoimmune disease. It works for non-autoimmune disease. It works for chronic disease. It works for most things that you have because 98% of health issues are choices we've made that have led to a detriment in our health. Be that the foods you choose or the lifestyle you live or the medications you take or the supplements you take or don't. Or watch this, how you take care of your master system called your nerve system. Hey, the ebook we're giving away for free today is called Diabetes Heal Thyself. And like a very famous author once said, you should never leave home without your book. Well, guess what I did? I left home without the ebook today. So I don't have it to show you on our live streams, but you can still get it. It is free. 704-906-2094. Hey, that's the call line for the entire hour of our show today. We are commercial free, uninterrupted for the next, 50 minutes. And you can call it at any time. If you're on the live stream, see down there this beautiful banner that my web team figured out how to put on our live streams. Just wait for the phone number to show up and text it, 704-906-2094. It is the call center line. You can talk to the people in our call center. They're just going to ask what's your name and your phone number and your email. Or you can just text it right now, 704-906-2094. What are we calling in for? Well, it's a 30-page ebook, more or less, on how to solve type 1, 2, and 3 diabetes. Now, last week I had someone comment on our live stream, you can't fix type 1 diabetes, it's autoimmune. Well, that's true some of the times. Diabetes type 1 could be autoimmune, but I don't claim to fix anything. I can't heal you. Only God and the power inside of you can heal you. But let's ask a deeper question. If it is autoimmune, what's causing the autoimmunity? Why is the body attacking itself? If we find that cause and reverse it, the autoimmunity calms down and thus the pancreas heals itself. So is autoimmune treated medically with a cure? No. Is diabetes treated medically with a cure? No. Is cancer treated medically with a cure? No. Is any disease treated medically with a cure? No. So medicine can't cure diabetes. I can't cure diabetes, but you can. You see the difference here? I know it's subtle, but it's a philosophical shift to the idea of take responsibility for what you have and go work on it yourself. Now, are 2%, according to the research, 2% of conditions something that no matter what you did, you wouldn't get rid of it? Yeah. If you have sickle cell anemia, good luck reversing that. That's genetic from birth. If you have Wilson syndrome or some sort of tri-X where you have an extra chromosome, good luck trying to pull that chromosome out with a detox. You're not going to do that. But if you have a condition that you weren't born with, that you developed at said point in your life, rock on and go heal it. Because there was a stage where you didn't have it, and if there was a stage where you did, something caused it. And all I'm going to let you guys sit with is, if you find the cause and you fix it, the body will give you the cure. It works 100% of the time, all the time, because that's how your body works. It's kind of like, let's see if I can come up with another example. Oh, how about this? So a manufacturer of a car makes the car to run on a specific type of fuel. And let's use a 2022. And let's use something that's, like a decent car. Let's say an Audi, whatever, an R8, if there is such a thing. I think there is. So you got this really nice car. And this isn't like a, simple car because it's more luxurious and it requires the top end gas. Okay. So it's going to say there's going to be labels all over the gas can and the flap that says only 93, warning, only 93. Now, ready for this? Do you have an option to do 90 or 89? Well, of course you do. When you pull up to the gas station, you've got 3 choices of fuel to feed that car. Now, you might say, well, Dr. Ernst, it doesn't really matter. The 89, I've been using it in my car for years. There's no problem if I put in this one. Well, go do that. Okay, I have a car that requires 93, and I put 93 in it because that's what the owner's manual says. It says if you want this car to last, use this fuel. Now, do I get to choose if I want to put something less in it? Yes, but there's going to be a consequence, even if I don't see it the day I drive it. Well, I did it today, and I drove 400 miles, and it seemed fine to me. Let's do it again. Okay, but 5 years later, when it's a rocking and a knocking, and the camshafts are screwed up, and you're leaking oil all over the place, don't blame the manufacturer, blame the user. Now, are we a car? No, we're way more technologically advanced than a car. But you understand the idea? I believe there was a creator of this engine, and I believe that he gave it a manual and said, this is how you fuel this car. And it's going to shock you because it's not food that fuels us. Fuel gives us the energy we need to live our lives, but you can go 40 days without fuel and still be functioning. So obviously something's giving this thing power. It's coming from somewhere. If you're a Christian, you'd say it's God himself who fuels you. And I believe in that. You remove God from the equation, watch what happens, man. Sickness, illness, disease, misery, and death in a human body. Some of you will call it nature and that all-encompassing powerful force called Mother Earth. Well, to me, it's the same thing, but if you want to say that, tomato, in my world, all the same. But even if it is Mother Nature and the universal powers to be, someone is still supplying you with an energy or something, an energy that you can't tangibly get from the outside. Now let's talk existentially. The chiropractic profession calls it innate. They'll say it's the power within. It is your spirit being. It is the essence that makes you who you are. If you were to take an identical twin clone and stick them next to me, and their name was Aaron 2, and my name is Aaron 1. By the way, my first name is Aaron. It's Dr. Aaron Ernst, but at any rate, Aaron 2 sits here genetically, identically, similarly, perfectly the same as me. Yet somehow we're different because I will think different thoughts and have a slightly different personality than this Aaron version the same. And you know what's even crazier? In the research, they show sometimes Aaron number 1 gets cancer genetically. Aaron number 2 never gets it. But how can that be? He has the same genes. Well, maybe he doesn't have the same power flowing through him. Yikes. I know I'm going deep. But here's the thing, guys. We know now there is this existential energy that lives inside a human being that you don't have when you're dead. So if I was to cut out an organ from my body and let it sit on a counter for too long, it's going to fade away and waste away because there's no life source flowing to it anymore. And before you say, well, that's because you removed the blood from it. Well, we now know there's more than blood that goes to organs. There's lymphatics, there's nerve energy, there's even lymphatics, and there's even things that I guarantee you we don't even know about today that in the year 3032, whoever's doing a radio show then, if there is even radio, will say, well, now we know there's blah, 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 because we learn more about the body every day. How am I trying to lead you guys onto this? Well, look what some of the current research is showing. And I said look because the only way you're going to see this graphic is if you get on our live stream. Now, I could sort of post it as a download afterwards if you want. Yay. But notice what you're looking at here is a diagram of the human brain, the spinal cord, the spinal nerves, and the pancreas and its individual subset tissues. Okay, I'm using some fancy words, so hopefully you understand this. Cells make up tissue when you clump them together. Tissues make up an organ when you clump it together. Organs make systems when you clump them together. And systems make you when you clump them together. So a nerve system, for example, is the brain, one organ, the brain stem, another organ, the spinal nerves, another organ, and all of the fibers that come off of them. Your digestive system is your mouth, your teeth, your esophagus, your throat, your stomach, your gallbladder, your liver, your pancreas, your small intestine, your large intestine, your colon, and all of the things that feed that. So notice multiple different organs creating a system. Guys, what they have found out in research is your nerve system is the trumping master. It regulates all other systems. So you can't have a digestive system without a nerve system. Because if I remove your nerve system, you no longer have that essence of energy flowing through you. It sounds gross, but imagine if we took a monkey and we removed its brain and we're like, let's see how long the heart beats. Not very long. Let's see if they can swallow food. They can't. Well, let's push it in their stomach with an IV. There's no blood flowing, so the IV doesn't go anywhere. Do you guys see what I'm talking about? So evidently, there's something in your brain that is more important than the white matter and the gray matter. It's the energy that it produces. And now we go super existential. Where does the energy come from? And how does the brain know to do what it's supposed to do? And where does life begin? Well, now we're going into metaphysical, spiritual realms. I think it's innate. It's an inborn energy that runs you and keeps you going 24/7. And you mess with innate, you've messed with your systems. And when systems shut down, that's called disease. But then here comes a medical doctor. I'm from the outside. I will fix you inside by cutting you apart and taking you apart and smushing you with medications that make your body do things it shouldn't normally do, but that's okay because we'll monitor you. And if you have a side effect, we'll just give you another medication to cover the side effect. And if that doesn't work, we'll just cut the organ out. And if you're still alive, good for you. And I'm being facetious, but you know what I'm talking about. Outside in therapy has never worked because you're not deficient in the medication that you're taking to manage your symptoms. You might have a nutrient deficiency. You might have a neurological deficiency, and thus the show topic for today. Okay, I feel like I've warmed us up enough. If you're still with us, some of you may have tuned out going, I thought this was a health show. Why are we talking about God and the universe and spiritual energy and innate energy? Because it's a health show. If you want some more information, we have some free books and ebooks available to you guys. My current one is called Diabetes Heal Thyself. It's going to explain what I just mentioned, the existential down to the physical, nerve energy, toxicological energy, digestive issues, causes of diabetes, and things you can do to reverse it right now. 704-906-2094 will be the call line that what you do is call in and say, I want the book. I want the webinar. By the way, the webinar is on Saturday, September 10th. It's at 10 a.m. in the morning, and it's going to give you everything you need. It's live. I'm going to come right to your computer just like this with the same camera that I have right there, except I'm going to be able to say, type your questions and let's answer them now. I don't know if you know how awesome that is. To have a doctor online for an hour and a half that you can ask any question you want for free? Yeah. That's amazing. 704-906-2094. The number again, 704-906-2094. So for those faithful viewers on our live streams, let's start the thumbs up and the likes, because though this is super duper complicated, it's actually very easy when you look at it real close. What does this say? Well, it says the brain right here has some nerve fibers that go down the spinal cord to about here, and then they exit through something called the vagus nerve. I think you guys have heard me talk about that once or twice or three times before. My goodness, it's hard for me to keep that centered on the camera. Vagus nerve. Now notice the vagus nerve comes out and branches off to portions of your pancreas. And then down here, these are the spinal nerves. And notice that there's a spinal nerve that comes out and also goes to the organs of your pancreas, but it goes to slightly different portions. But technically, they're all controlled by both the vagus and the sympathetics. Now, listen to what this says. Your brain sends a nerve down something called the nodose ganglion so that it exits as the vagus nerve and it goes straight to the islet cells of the pancreas. Now, why is that important for someone who's diabetic? Well, those islet cells make insulin. So if I was to cut that wire, the nerve, the vagus, the islet cells would say, we lost the signal from the brain. Now, if you're still alive, they're going to do whatever they want because they're not regulated now. There's no checks and balances. They'll make insulin whenever they want to because that's what their job is. It's like if your job is a hammer, you're going to think everything's a nail. Like, think about it. If you're a hammer, a hammer, everything you hit is a nail because it doesn't matter what you do. Your purpose is to hit things. So if your purpose is to make insulin, no matter what happens, you make insulin. So the job of the brain is to say, hey, slow down. We don't need any insulin right now. Oh, okay. And the cells of the islets say, when can I do this? I want to make insulin. Not yet. Not yet. Well, when can I do it? Not yet. Well, when? Now! They just ate something. Now. Go, make insulin. Okay, the islet cells are making insulin. Oh, I love those slides. I'm so happy. I'm making insulin. And guess what? The sympathetics are like, yeah, make some more insulin. And then the insulin comes out, and the brain's like, hey, stop. Why do I need to stop? Well, you brought the sugar levels down and they haven't eaten anything for 2 hours. Oh, okay. But we really want to make more insulin. Can we make more insulin? Please, can we make insulin? And the brain says no. Now, I know that's a simple analogy, but do you understand this? Nerve damage can shut off the regulation of how insulin is produced. So therefore, if it's low production, that's type 1. And if it's high production, that's type 2. You see how easy this is? The vagus nerve slows down the production of insulin. So if there's damage to the vagus nerve, shoo, insulin goes through the roof because the brain isn't saying stop. So vagal nerve damage is classically seen with type 2 diabetes. Now watch this. The sympathetic nerves that come out of the middle part of your back exit this thing called the dorsal root ganglion. They hit the celiac ganglion, and then they hit the splanchnic nerve. I know it's tough. You got to learn if you're going to heal yourself. And then that splanchnic nerve goes to the pancreas, and it tells those insulin cells to make a ton of insulin. So if we damage the sympathetic nerves, the brain doesn't tell the pancreas to produce insulin, and you don't get a lot of insulin, and that's called type 1. Do you see what I just described to you? The neurological cause of both type 1 and type 2 diabetes. Dr. Ernst, how can the same cause two different conditions? Because you have two different types of nerves. Speed up nerves, slow down nerves. If you damage the slow down nerves, the system speeds up. If you damage the speed up nerves, the system slows down. And isn't it funny how even in medicine, if I pulled an endocrinologist and interviewed them, hey, welcome, Mr. Endocrinologist. Thanks for having me here. Are there two types of nerves in the human body? Actually, there's more than that. But if you're talking about the branches of the nerve system, yes, there's the sympathetic and the parasympathetic. Oh, wow. Okay, so what does the sympathetic nerve system do? Well, it speeds things up. Okay, and what does the parasympathetic nerve system do? Well, it slows things down. Okay, so the nerve system can both speed up and slow down things. Yes, we call that homeostasis, the art of keeping yourself in a rhythm so you're not too high and not too low. Okay, so Mr. Endocrinologist, MD, if someone was to damage the parasympathetic nerves, wouldn't that stop the slowing down systems and signals? Why, yes, it would. And what would be some of the symptoms you might see in an individual when they can't slow things down? Well, you would see elevations in all the autonomic systems. Could you translate that into English for us? Yes, there would be high blood pressure, high cholesterol, high triglycerides, high blood sugars, high everything, because the brain can't slow the systems down. Okay, so what you're saying then is all of those are caused by a loss of parasympathetic tone. Well, actually, I am. Do you see the problem here? They know it to be true, but there's no drug that fixes it, nor is there a surgery that fixes. Well, actually, you know what? There is a surgery that fixes it. It's now known as vagal nerve therapy. Listen to this. They implant surgically an electrode around the nerve, and they give you a remote that lets you go and zap the nerve, because if we stimulate the vagus nerve, you lose weight, your blood pressure goes down, your cholesterol goes down, your triglycerides go down, your diabetes goes down. Do you see this? So you can have a surgery to have your vagus nerve stimulated externally. It's about 10 to 15 grand and runs a subtle risk of permanent paralysis if they mess the nerve up of your organs. So if you're okay with this risk, have at it. The only thing is as you know, if you zap it with an external electrical current, eventually you're going to burn the nerve out and then it no longer works. But in rat studies, they have figured out that if you stimulate the vagus nerve with electricity, you get a reduction in blood sugar. So what did they just prove there? The vagus nerve is not sending the appropriate electrical signals by itself. And if we zap it with some extra juice, it'll do it for us and we get a positive result. Now, notice what they're not looking at is why is it not working in the first place? And we're going to go through the number one reasons why you might have vagal or parasympathetic nerve damage in a moment. Now, I pulled this graph from a study that was done to show the brain does regulate your glucose. And what you can see here, if again you go to our Facebook and our YouTube handles, Ask Dr. Ernst, is that the brain has a afferent, meaning from the organ to the brain, and an efferent, meaning from the brain to the organ signal. And in essence, it's kind of like a road. The brain sends a signal to the organ sends a signal back to the brain, and they talk to each other. Okay, this is basic neurology. Now, what's very interesting, if you can read this, is it says the afferent nerve signals send the message of glucose signaling. They send the lipid sensing, hormone sensing, and interleukin 1B level sensing, kind of like an immunological response. So the organ senses what's going on with sugars and fats and hormones, and it sends a signal. See that 80% signal send to the brain, and the brain hears it and responds either with hormones or transmission of the vagal nerve. This says specifically vagal dampening of inflammation. It says liver regeneration, metabolism increase, hepatic vasculature changes. What does this mean, guys? 20% of the signal is coming down the nerves, the vagus, to tell the liver what to do. But this is interesting, isn't it? 80% of the signal is going back to the brain saying, well, here's what I did. Now, envision this. It's like a safety pin. When they're connected, there could be an electrical current flowing all the way through this. But the moment you unhook that sharp part, well, now it's not connecting anymore, so there's no electrical current. So what they're now discovering in the research is your brain actually senses what your organs are doing and controls them by sending a subtle signal neurologically back saying, whoa, slow down there, champ. You're not supposed to do that. Or it'll say, hey, wake up and do that harder. Now, I've had some people actually say, there's no way this is actually like true. Like, you've got to be kidding me. Like, I've been taking insulin for type 1 diabetes for 12, 20, 50 years. In fact, I even have a pump. Like, if they knew this, wouldn't they have done something to my nerve tissues to help me heal? Well, no. Partly because, A, you're talking about upper level neurology that unfortunately most medical doctors don't even know about. Number two, you're talking about treatments that don't require medications or surgeries. And number three, you're talking about going into the holistic arts to clear nerve damage. Unless you want to implant an electrode on the back of your brain and have a little nerve zapper, so when you need a little extra weight loss or when you need your blood pressure to go down, but the problem is, how are you going to know when you need it? Okay, now this is where it gets really crazy. I pulled this from the Trends in Neurosciences. This was a study done where they were proving that the cells within the pancreas that make insulin are directly connected through the spinal cord and this area called the dorsal motor nucleus with a parasympathetic nerve, the vagus, that increases insulin and increases glucagon. Now, I know some of you are like, Dr. Ernst, like my head is exploding already. I feel like I'm in like a fifth year med school lecture. Take a deep breath. What I'm trying to show you is the science is out there and sound. It shows that you have a nerve in your neck called the vagus nerve that tells your pancreas and your liver how much sugar to make and how much insulin to make. It also shows that there's a nerve in the middle of your back called the sympathetic nerves that regulates the speed at which this happens. So what I'm trying to show you is this little guy here, we can call him Spiny Sam or whatever you want to call him. We'll just say his name is Spine. I like Sam Spine. So his first name is Sam, his last name is Spine. So here's Sam Spine, and he has diabetes. And he comes to a medical doctor, and what they do is they say, we're going to run some blood, and we're going to see how bad your diabetes is. So they run some blood, and his blood sugars are 226, which is very high, and his A1C is 9.6. The doctor sits with him and says, Sam, your diabetes is completely out of control. If we don't do something about this, you're going to die. And Sam gets freaked out. I don't want to die, doc. What should I do? Well, we have a plethora of medications that if you take that and you control your diet, it looks like you're a lazy slob. You must eat nothing but sugar all day long. Actually, I just became a vegan. What? Well, I don't want to hear that. That's not possible. Your sugars say you eat sugar all day long. Like you drink sugar for breakfast, you eat sugar for lunch, you drink a bottle of sugar for dinner, and you go to bed. I don't do that, doc. Well, your labs don't lie. You're a diabetic. Oh, okay. So it must be genetic then, because if you're that clean with your diet, there's no human possible way you can have diabetes. So therefore, you can't fix this with your diet. Oh, phew, okay, thanks, doc. So I can go back to eating Chick-fil-A, McDonald's, and KFC? You could if you want to, but we don't recommend that. Okay, so now, Sam, here's how we're going to fix this. We're going to put you on some medications that's going to lower both your A1C and your blood sugar. You shouldn't have to change your life at all outside of the fact you got to remember to take your medications. Wow, doc, this is great. I can't wait. So Sam goes out and he goes to the pharmacy and he gets his prescriptions and he starts taking them and his blood sugars go down. Again, remember, a drug is designed to do what it's supposed to do, but it doesn't go to normal. It brings them from the mid 200s to the mid hundreds. And so he goes back in 90 days and his doctor reruns his labs and says, Sam, the drugs are working. You're no longer raging, uncontrolled type 2 diabetic. Now you're managedly controlled type 2 diabetic. Gee, doc, does that mean I no longer have diabetes? Well, no, it just means you're managing it well. Okay, what do I need to do to get rid of it? Well, we told you it's genetic. There's nothing you can do. You're going to have to take these medications for the rest of your life. Oh, okay. Am I good? Well, your sugars are a little high, but your A1C is now a 7, which is better, but you're still a diabetic. Okay, do I have to worry about anything here? Well, there is a risk for heart disease, cancer, ocular issues, glaucoma, numbness and tingling, amputations in the future. Wow, doc, you're starting to scare me again. What should I do? There's really nothing you can do. You could lose 20 pounds if you try. You're about 40 pounds overweight, so why don't you go join a gym and try to sweat that off? All right, perfect. So I'm going to start working out, and I've been taking my medications. Thanks, doc. Okay, so now Sam goes and joins a gym. He works out every day for 90 days, and he goes back to his doctor, and his numbers are worse. I don't understand, doc. I added what you told me to do, and I've been taking my medications. Why are my sugars worse? Well, are you still a vegan? Yes. Okay, I don't know, but we're going to up your meds because it looks like it's getting worse. So I'm going to double your dose, and I'll see you in 90 days. Oh, okay, perfect, doc. I'll be back. Should I keep doing everything I'm doing? Yes. You know the story. Okay, now, some point, Sam is going to wake up and go, I'm sick and tired of doing this. I don't want to keep taking these medications. In fact, now my liver enzymes are elevated, and I'm having problems with my feet, and I haven't lost any weight, and I'm getting tired and fatigued all the time. And Sam happened to listen to this crazy doctor on the radio, and he heard about this diabetic program, and he called the doctor and said, can you help? And the doctor called Sam and said, Sam, listen, I got a question. I see your history. You've been taking medications. You've been working out, and you're a vegan. How are you feeling right now? Well, I don't know. I'm frustrated. I've been doing everything I can, and nothing's working. Well, I have a couple questions for you. Has your doctor ever tested you for what's causing your diabetes? Yeah, they did. They told me it's genetic, and I can't do anything about it. Did they actually run the genetic test to see if you have the gene for type 2 diabetes? No. Well, then how do they know you have a genetic dysfunction? Well, they told me I did. Well, did you prove it? I did not. Okay, that's fine. Did they tell you what's causing your diabetes? Well, doc, I just told you. They told me it's genetic and that I can't do anything about it. I'm a vegan and I work out all the time. I don't know why I have diabetes. Well, Sam, let me ask you a question. Have you ever been checked for heavy metal poisoning? There's several studies that show lead, mercury, aluminum, arsenic can actually cause damage to your insulin receptors. No, I've never had that test. Okay, have they ever done a neurological exam? There's something called your vagus nerve. And if you look at the Trends in Neuroscience report from last year, it shows that your vagus nerve and your sympathetic nerves might block the ability for you to make the correct amounts of insulin, and that can cause insulin resistance. What? I've never heard of this. How come my doctor didn't tell me about this? Well, they're not neural endocrinologists, so that's probably why they didn't tell it to you. Okay, so doc, it sounds like you know what you're doing. How can I get help? Well, Sam, you need to get tested. Well, I've already had my blood tests from my doctor. Can I send those to you? Sam, those are not the tests I'm talking about. You need to have a nerve scan, a neurological assessment of your vagus and sympathetic nerves. You need to have heavy metals assessed for us to see if you have poisons and toxins in your body. Wow, doc, that sounds great. I've never done this. How do I do it? Well, we're going to schedule your appointment in our clinic, and we're going to see what we can do to help. Perfect. I'll see you on Friday. Okay, so now Sam comes into our office physically, and what we do is we take an x-ray and we go, Sam, do you see this? Your head is curving to the left. It's always been like that. Every photo I've ever had, even my driver's license shows that. I don't have any neck pain, so it's no big deal, right? No, Sam, your thermogram is lighting up. You have nerve interference in your neck. We need to take an x-ray so we can see what this looks like. When was the last time you had an x-ray of your neck? Well, I've never had an x-ray of my neck. I don't have any neck pain, so why would I take an x-ray? Well, Sam, your logic is sound medically, but we don't take these x-rays for pain. We look for nerve damage. Are you okay if we take an x-ray that will see if the nerve damage is causing your diabetes? Yeah, let's do it, doc. So he gets an x-ray, and it comes back, and we discover Sam has a massive misalignment within his skull. Just so you know, those of you watching our live stream, that skull should be straight, and his is tilting way off to the left. Vagus nerve exits right there, and that's an indication on x-ray of vagal nerve damage. Now, we do thermograms and other imaging studies to determine the amount of damage, but Sam just tested positive for vagal nerve compression, which could be an underlying root cause of his diabetes. Now, his blood and urine came back and shows he's aluminum toxic because he uses standard deodorants, which have aluminum in them, and he has lead in his blood and his body and his organs. Lead is something that we tend to still find today as a neurological irritant. I sat down with Sam and showed him his x-rays and said, okay, Sam, do you see this? I do. Do you see these? I do. Doc, what am I supposed to do? Well, let's test and see if this is really the true cause. If we can reduce this subluxation, the alignment in your neck, and we can get the lead and the mercury and all the aluminum out of your body, your blood sugar should go down if that's the cause. How quickly will this happen? Well, sometimes we see it happen in as little as 1 to 5 days. I'm willing to try it. Let's do anything. This is frustrating. So he gets an adjustment, his spine gets straightened out, and he does chelation for lead, and in a matter of weeks, his sugar starts dropping so low that he begins to crash. And when I mean crash, it's like, well, now his sugars are reading in the 50s and 60s. And we're going to have a conversation with him going, hey, you need to talk to your primary physician because they gave you these medications based on your sugars being up here. And now that you've addressed the root cause, your sugars are going to drop, but you're chemically pushing them too low. Sam will be sent to his primary physician to have a conversation about reducing or eliminating his drugs, and the labs will be sent with him so that he can show his doctor what he's done. And the doctor will generally say, yeah, you need to get off these now. Now, that is a story that happens over and over and over again in our offices. But the question is, does it happen in your medical practice that your doctor goes to? The next time you're there for your annual physical, ask them, hey, doc, how many people with my condition have you cured to where they don't have to take their meds anymore? Like, I'm on blank medication. How many people have you gotten off of those? And the answer is going to shock you. And hopefully it helps you to wake up to the realization that you need to do something about this. Now, I know there are skeptics listening. There always are. Where's the research behind this? Okay, well, I'd like to read you one that was published in the Journal of Pediatrics in volume 2011 under the title Improved A1C Levels in a Patient with Insulin-Dependent Type 1 Diabetes Undergoing Chiropractic Care. So I'm just going to read this to you and tell me if you think you're like, wow, that's unheard of. But again, it was published in 2011. The objective of this study was to describe if chiropractic care could have a clinical outcome for type 1 diabetes. It was a 4-year-old female, because again, type 1 is typically in children, who was diagnosed with type 1 diabetes, came in for an evaluation of nerve exams, and there were subluxations or alignment issues found in the neck, mid-back, and pelvis. The patient was seen 24 times. Sounds like a lot, but if you're going 3 times a week, it's barely just 2 months or a little bit more. There was a technique of chiropractic adjusted so that the spinal alignments would reset, and there was a significant decrease in both hemoglobin A1C, which resulted in the less amount of insulin needing to be injected. So the conclusion of the study was chiropractic care with pediatric patients with insulin-dependent type 1 diabetes presents evidence that it could help to manage or reverse the condition. Thus, further research is warranted on chiropractic care and diabetes. Have you ever noticed how in every research study that's ever written, when they find something outrageous, like, hey, if you stop eating processed foods, you'll lose weight, the conclusion of the study will say, we are proposing people should stop eating processed foods if they want to lose weight, but more studies need to be done to confirm that this is correct. Except thousands of studies have been done to confirm it, but yet we still need to say more studies need to be done. How about this one? In the year 2006, published in the Annals of Vertebral Subluxation Research, which is a peer-reviewed research study in the Journal for Chiropractic Care. Normalization of blood and urine measurements following reduced vertebral subluxations. Translation, they're removing the nerve damage in a patient diagnosed with early onset diabetes mellitus, which is type 2. This study was done to determine the effects of chiropractic care on a broad spectrum of conditions, including diabetes mellitus. The case was a patient who is seen by chiropractic care, dietary modifications, and exercise to significantly lower their sugar levels. The treatment was a specific occipital fiber release. Now, it sounds fancy, but the occipital fibers are what's behind the skull, and they're the muscles that contract and squeeze the vagus nerve. They used a chiropractic manipulative reflex technique, which is a soft, gentle adjustment to ensure the pancreas and the adrenal glands were connected neurologically. Results: within 1 month of treatment, glucose levels and urine levels normalized and remained stable for the remainder of care. Did you hear that? Blood sugar levels and both the urinary glucose levels. Look, if you have if you have sugar in your urine, that means that your blood sugars are north of 200, uncontrolled diabetes. The kidneys are supposed to hold sugar back. So it says, future research is necessary to determine what percentage of patients with diabetes could benefit from a combination of chiropractic care, diet, and modifications of exercise. But I'd like to say 100% of patients with type 2 diabetes could benefit from cleaning out their diet, exercising, and getting their spine adjusted. Now, I know what you're saying, like, oh, seriously, I have to do this thing called chiropractic. Well, look, you don't have to do anything you don't want to, but where are you in your health journey? I've been in the chiropractic profession for 15 years. I've been in the functional medicine profession for 15 years, and I see a tremendous amount of people who are super frustrated with the classic healthcare approach. Take this for that, and let's see what happens in 6 months when we repeat your labs, only to find I have to take more. Now, what's unique is I can keep going with this. 2008, chiropractic care in a 9-year-old female with vertebral subluxations, diabetes, and hypothyroid. So hold up here. 2 conditions that are completely separate medically, a non-working thyroid and diabetes. Somehow the nerve system is going to fix both. Well, let's go back again to the starting of our show. You have an innate energy inside of you that regulates all of your systems and all of your organs, called your innate immune response. It lives inside your spinal cord and brain. So when you have an interference in the nerve tissues, that innate healing power is lessened or blocked, and therefore systems shut down. If you have a subluxation in the same vicinity of the vagus nerve, here's the thing about the vagus nerve, guys. It goes to every organ in your body. The pictures I've presented just show how the vagus nerve affects your pancreas or how it affects your liver. But you know what? I could equally find diagrams that show how it affects your thyroid. So just listen to this. A 9-year-old with diabetes type 2, which is supposed to be for adults, and hypothyroidism, experienced chiropractic care and had successful changes of their diabetes and their thyroid. Controlled blood glucose levels were achieved, and stabilization of the amount of insulin needed per day was achieved, and improvements in sleeping patterns and thyroid levels as seen on blood work was improved. Hold up. One treatment fixed two different systems. It's because what we do is we focus on the nerve tissue and its functionality. Is it at normal tone, 100% signaling, or something less? And we release that innate power found in the nerve system. And your brain is so smart, it's going to know if you need work on your right knee or your left elbow or your thyroid or your pancreas or your stomach, your intestines, your spleen, your adrenal glands, whatever. And this is why so many people who undergo chiropractic care start to have what are called silent miracles. Well, they'll say, God, I was going to you because I had headaches, but now all of a sudden, I don't have to take my asthma medications anymore. Can you help me connect how that worked? It worked because innate took over. The healing systems from within can help any area of your body. Remember, medicine is a this for that world. You go to this doctor for that condition. You don't go to that doctor for this condition because gastroenterology has nothing to do with cardiology, and cardiology has nothing to do with neurology. So if you have a neurological issue, you don't go to a cardiologist, you go to a neurologist. But the neurologist is going to say, well, as an MD, we can give you medications, we can do a surgery, or that's about it. We can give you special medications that a special neurologist goes to, and we can even do a special surgery that a special neurologist does. But do you see the disconnect? What I'm teaching you is your brain controls all of your systems. So if you have diabetes, we have to look at it as it's a pancreatic liver issue. If you're producing too much insulin, that's type 2 diabetes, you burn the receptors out, they become resistant, and that's because there's damage to the nerve system that controls the production of insulin. The sympathetic system that's supposed to make more insulin is damaged, so you make tons and tons of insulin. Then you have the ones that, they're making not enough insulin. Those are the type 1 diabetics. And they have issues with the sympathetic system and the vagal system. If you hit the brakes, you'll slow down. But if your brakes don't work, you won't slow down. If you hit the gas, you'll speed up if it works. But if there's no connection between the pedal and the accelerator, then guess what? You don't go any faster. So if you're interfering with the system that tells the organs what to do, they won't do it. Now, how do we differentiate between the nerve damage that is called vagal nerve damage and the nerve damage that's called splanchnic nerve damage? Well, it's all depending upon the exams that you have neurologically. Could we do an MRI and find nerve damage? You bet. Could we do an X-ray and find nerve damage? Absolutely. Could we do a thermogram, which is a special type of imaging that looks at the heat signatures coming off your body? Absolutely. If we took a picture of your back with a special camera and you've got a hot spot sitting in the middle of your back, T5, 6, 7, or 8, we know that that's hot heat damage to that system. And the middle of your back, the thoracics, is the sympathetics. So here we go. If we damage the nerve that's supposed to speed up, then we don't speed up. So insulin production goes down, and that's called type 1 diabetes. So most type 1 diabetics have thoracic nerve damage. Never detected because they're not seeing a true functional neurologist. Then you have those that are the, what I call type 2 diabetics. And what they have is typically vagal nerve damage, where there's a misalignment in the skull that's affecting the vagal nerve function. And the reason for that is the vagus nerve comes down the spine, leaves the brainstem, and goes to the islet cells and says, hey, slow down. We need to regulate this insulin production. So if the vagus nerve is damaged, what we get is we don't see a slowing down of insulin. So insulin's just being produced left and right, even though it doesn't need to be. And that insulin's floating around in the blood. And because it's there all the time, it damages the receptors and it causes insulin resistance. This is why a type 2 diabetic has high insulin and high blood sugar, but a type 1 diabetic has low insulin and high blood sugar. I think it's time to ask some questions. So look, if you have a question for us, we're live, we're in the studio. Here's the camera for Facebook. click the like buttons and use the comment field. Dr. Ernst, here's my question. And let's see what it is. If you're on Google, which is over here, scroll down to where it says comment and leave a comment, and then we can comment to your comments. Okay, this is the opportunity to get engaged. It's also the time right now to say, whoa, evidently I need to learn a lot. Listen, I know how to do this, but I've been doing this for 15 years. I can help someone with type 1 diabetes learn what they need to learn so they heal themselves. Do we heal diabetes? No, but we teach people what they need to do it. Does your financial investor make you millions of dollars? No, they teach you the habits and the steps to do it, and then you make millions of dollars. That's how this works. So if you're someone who is going, I don't have diabetes, but I have a thyroid issue, connect with us. Head on over to AskDrErnst.com. We have free consultation offers. I'll call you directly if you want. How long have you had this hypothyroid issue? Have you ever had this checked? If you have high blood pressure, let's do the same thing. Head on over to AskDrErnst.com, type in blood pressure, hit the request a consult. But that's only if you want to take the next step. Some of you right now, I've been seeing the text coming in. Look at this, right? We're giving away a free ebook, Diabetes Heal Thyself. All the steps on how to know, test, and get rid of type 1, 2, and 3 diabetes. It's yours. 704-906-2094. 704-906-2094. Call now or text now, and guess what? You'll be able to get the ebook for free, and you get access to the webinar that I'm hosting on September 10th for free. So I want to leave you with a couple things. Brand new study, literally published this year. I'm going to read a couple things to you guys. We've got about 7 minutes. Let the questions come in. I'm going to answer them in a minute, but I want you to hear this. Quote, the vagus nerve regulates energy metabolism, food intake, and glycemic control. It has been found that by applying different electrical stimulation strategies, that you can change insulin secretion. In particular, applying high-frequency 40 kilohertz stimulation to the vagus nerve lowers sugar secretions and may have a potential application for developing new treatment in type 2 diabetes. Did you hear that? This is a study that was published that showed if you stimulate the vagus nerve with an electrical current, 40 kilohertz of energy, blood sugar goes down and insulin regulation is improved. They showed that with low frequency, 15 hertz vagus nerve stimulation, it affects both the efferent and afferent fibers. I'm going to pull the picture that I pulled from the study. 15 hertz stimulates both of these. Now, here's what's really unique. An adjustment with a chiropractor who uses an instrument called an arthrostem, get it? Stimulation. They function in the range of about 12 to 15 hertz. So ultra low frequency, 15 hertz, the same percussion an instrument could apply to the spine affects both the afferent and the efferent. And here we go, ready? Causing a substantial increase compared to the unstimulated effects of glucose-challenged rats. Hyperglycemic effects can be attributed to the activation of the afferent nerve, the nerve that comes from the liver up to the brain. You activate that nerve, and they saw sugars went up. Hepatic vagal nerve stimulation reported a drop in blood sugars, inducing insulin-like hypoglycemia. I know this is a medical study I'm reading to you guys. What they're saying is if you low frequency stimulate the nerves that go to the liver will make sugar. If you low frequency stimulate the nerves to the vagus, the sugar production turns off. What they're showing you is that you can make yourself a diabetic by stimulating the sympathetic nerves, and you can turn yourself from non-diabetic if you stimulate the vagal nerves. Electrically driven increased signals to the vagus nerve may simulate a hypoglycemic state that leads to feedback of the brain. Now, I don't know, again, to me, this is like, oh my God, do you realize how amazing this study was? They have proven that if you stimulate your vagus nerve, you can lower your blood sugars and increase your insulin sensitivity. I'm going to read the conclusion of the study to you. In conclusion, stimulation of the vagus nerve modulates glycemia, which is sugar levels, and affects the amount of sugar produced by the liver. Application of stimulation, which showed the ability to lower sugars, can have a potential application for the treatment of type 2 diabetes. There it is. They just said, in subtle words, if you go to a chiropractor and you get your vagus nerve fixed, you could see your blood sugars go down if you have type 2 diabetes. Well, how is your spine involved in this? We talked about it from the beginning. Your brain sits in your skull. It sends a cord down through the tube of the skull. The nerves come out between the bones in your neck, and they go to your organs. Your nerve system, brain, spinal cord, spinal nerves. Your digestive system, mouth, tongue, esophagus, throat, stomach, pancreas, liver, spleen, intestines, gallbladder, rectum, colon. Those systems are regulated by your nerve system because this is the master right here. This controls everything. So if you have type 2 diabetes, I implore you to seek out structural specific neurological assessment using thermography and digital x-ray to find out if you are in alignment in the upper cervicals. If you need more information about what I just mentioned, what it actually is, and x-ray examples of what this looks like and how to know if you have it or don't have it, all of that is in our ebook, which is free. You can get it right now, 704-906-2094 by calling or texting now. Now, some of you have texted over saying, I want the diabetes ebook. So that means we have your phone number and we have the statement, I want your diabetes ebook, but we don't have your name or your email. In order for us to send it to you and address the book to you, we need name and email. So if you have texted in earlier and you forgot to put your name or your email, just go ahead and re-text the same number, 704-906-2094. And if this is the first time you're texting, hey, welcome aboard, 704-906-2094. Call it if you like. The call center is there. They're beautiful human beings that will chat with you for about 45 seconds. What's your name? What's your email? Have a nice day. And they take the next call, or you can text right now. I hope you found today to be informative, enlightening, and a level of refreshment. If you're a type 2 diabetic, there's hope for you. If you're a type 1 diabetic, there's hope for you. If you're a type 3 diabetic, there's hope for you in our next week's episode, because we're going to discuss what the heck is type 3 diabetes. I thought there was only 1 and 2. Well, we got to talk about that one. And again, don't forget, you were innately created, divinely developed, with a system that knows how to heal itself from within. Don't feed yourself the fuels of medicine. Rather, feed yourself the fuels of self-healing that come from you seeking the cause, reversing the damage, and letting your body heal by itself. It's as simple as that. If you'd like more information, visit AskDrErnst.com. Connect with us. We have free consultations, free protocols, free recipes. We like the word free because we should set you free from your disease. And if you'd like to join us for the webinar that we have coming up on the 10th of September, it's at 10 a.m. And again, it's free, and it'll go much deeper into how you fix diabetes. 704-906-2094. Again, 704-906-2094. Thanks for tuning in this week. I look forward to seeing you guys every Saturday at 12 noon right here on Fox Sports Charlotte. I love the fact that we've been here now, and we're going to continue this conversation towards diabetes, and then we're going to go to thyroid, and then we're going to go heart disease, and then we're going to go psoriasis, and whatever you want to hear from. Take a time right now and let us know if you have a health condition you want to be fixed. Comment in the live streams, and that is the topic of our shows